Welcome to CFP Distilled May 2023. My name is Dr. Simon Moore.
And I'm Dr. Paul Dill. We're going to be talking about some amazing guideline updates, some key new drugs available in Canada now.
As we do every month, we take a look at the CFP journal and we take all the clinically relevant articles and distill them down for you. What else do we do?
So we provide those clinical tips and pearls that you might not have time to read, and we give them all to you in a quick format here today.
And what do we do about the exam?
We prep you for the exam, so we filter everything out to let you know what's key for your exam to allow you to nail your SAMPs and SUs.
Phenomenal. First article from this month is about guideline updates. Should you be putting kids on a statin?
Pre-diabetes, pre-hypertension, preschool. Is that when we're starting to screen these kids and poke them and get blood work?
Absolutely. So let's take a closer look at this article. What did they recommend? This is a recommendation from the Pediatric Cardiology Societies, and they're telling us all these kids need to be screened.
Specifically, kids from 2 to 10 need to be checked with those, and particularly looking at kids with a family history of hyperlipidemia. It's high in Canada, 1 in 300.
So we're trying to find who has that because we've got a high incidence and we need to screen everybody. The article recommends universal screening.
But what do you do then with that result? So statins, can you start statins on a 2-year-old?
No.
So the real answer is 8.
8 years
8 years old is when you could potentially start it. So potential game changer. I don't know how this is going to roll out in real practice, but at least you heard it here first.
Taking a look at our next article.
If you've got both chronic kidney disease and type 2 diabetes, who are your best Kerendia?
Your nephrologist and your endocrinologist.
Other than that, there's a brand new medication, first in class. It rhymes with Kerendia. It's called Kerendia.
Exactly. And the actual medication generic name is finovrelolone.
You know what's great about the exam? You can use trade names. So remember, Kerendia. This is for those patients who have a normal serum potassium and you're looking for a non-steroidal MRA. So new class, great to know for the exam.
The American Heart Association has invented a new diagnosis when it comes to heart failure.
So what is that new diagnosis? I know we had diabetes, now we have pre-diabetes. I haven't heard of post-diabetes yet.
Well, it turns out the new diagnosis is called pre-heart failure.
So how would you diagnose someone with pre-heart failure?
These are folks who are asymptomatic, they feel fine, but they've got an abnormal lab test.
So they might have a raised BNP.
Turns out we should be treating these folks with 2 medications.
So what are those 2 medications for these people who may have structural disease? They might not be symptomatic, but have a raised BNP.
So you want to have an ACE up your sleeve, start them on an ACE inhibitor as your first option.
What's next after that?
You're going to give them a beta blocker. So that's the A and B for pre-heart failure.
There you have it. New diagnoses, new term. Think about pre-heart failure for the exam and when you're working in your clinic.